Welcome to the Medical Staff Voice Live. I'm Dr. Stan Frosweig, Chief Medical Officer at Community Memorial Health System. And I'm joined here today by Dr. Nick Tarlov, Interventional Neurologist. Welcome, Dr. Tarlov. So nice to have you here.
Thank you, Dr. Frosweig.
Oh, you're welcome. Thanks for joining us today so that our colleagues, our fellow physicians, and our community can get a better understanding of what it is that you do in your specialty. We also are going to ask a few questions so that we can be enlightened and clarify what your specialty and practice consists of. First of all, tell me a little bit about yourself. Where are you from and where did you train?
I'm from Boston, Massachusetts. I was born and raised there. I stayed there until I was 27. I went to college there in high school. Many of my friends are still there. My parents still live there. And after college, I worked at a chemical factory for about a year. I saved up money and then I traveled around the world for 3 years with a surfboard and a guitar. And I thought I would go into international medicine and infectious disease. My dream originally was to become an infectious disease doctor in the third world. That morphed into doing international medicine through neurology. And then eventually I decided on stroke neurology. I became interested in stroke partly because of my father, who's a neurosurgeon, who, when I was in high school and college, would point out people walking down the street who had a different type of gait, say a Parkinsonian gait, or the gait of the way that someone would walk if they had a stroke. And so I became interested in neurology because I'm an observer, and I was actually given a Hawaiian name when I was born, which is Ka'imi, which means the seeker. So my habit is to ask questions, and I'm a curious person. So a little bit of a self-fulfilling prophecy, and neurology suited my my personality. I saw myself like the other neurologists, as being like the other neurologists in my training. They spent a long time with consultations and like to think deeply about the problem that the patient was having to try to figure it out. And that's something that I like to do. I felt that as a neurologist, I could spend more time with each patient than I could in other specialties that I had thought about doing.
Thank you. That's really helpful. Let me understand, your practice sounds like it's in great part stroke related, and you are our stroke director, and that you do interventional neurology. A lot of people do not know what the interventional stroke neurology consists of. Could you explain that a little bit?
It's understandable because the field is relatively new. The first embolizations in interventional neurology, or what is sometimes called interventional neuroradiology or endovascular neurosurgery, were performed probably in the early 1970s in France in a hospital where I trained. And so the field has evolved in tandem within three different specialties: neurology, neurosurgery, and neuroradiology. So the terminology is confusing, understandably. So your question was, what is it that you actually do? As I understand, and as I've known from the cases you've presented, that you might put a catheter into an artery and either remove or dissolve a clot that has resulted in a stroke, and can actually, and you've described cases to me, that actually reverses the paralysis or the difficulty in speaking that a person often experiences as a result of a stroke. Yes, the most common neurointervention performed at CMH and in many hospitals is treatment of acute stroke. When a blood clot blocks a major artery in the brain, if the patient can get to the hospital soon enough and not very much brain tissue has died from the stroke, it's possible to remove the blood clot with special types of catheters and other devices. Then in some cases, the patient's problem, for example, the problem speaking or a problem moving one side of the body, in some cases that can be nearly completely or completely reversed. It's quite miraculous when you see it. In many cases, the patient is less disabled after the procedure than they would have been without the procedure, based on data from randomized clinical trials, which compare to a placebo group.
So one thing you've helped clarify and emphasize is that one of the critical aspects that many people make a mistake in doing is waiting once they first notice the symptoms. And you've explained repeatedly how it's critical that the sooner one comes to the emergency department for evaluation and potential treatment, the more likely the ability to reverse the problem.
Yes, that's absolutely correct. For every 5 minutes that someone waits before being treated with IV TPA, there's an associated 4% increase in the likelihood that they won't be able to walk by the time they leave the hospital. And the likelihood of a good outcome is also decreased by about 4% for every 5 minutes that you treat earlier with IV TPA. So time is critical.
Thank you. I'm very curious, and I actually don't know the answer to this question, and that is, what ages are you willing to treat, or are you trained and educated to treat? How young will you go?
I have performed cerebral angiograms in 16-year-old patients, roughly around that age. I'm most comfortable treating patients who are more than 18, and have performed procedures in patients who are close to 90. But the outcomes in mechanical thrombectomies, procedures to remove blood clots from the brain in people who have had stroke, tend to be better in people who are younger, 70, for example. But occasionally good outcomes can also be seen in very, very elderly people more than 80.
You know, we were talking a little bit earlier, and I'm not really familiar with this, and that is the non-surgical or non-craniotomy approaches to subdural hematomas. You treat subdural hematomas?
Occasionally, patients who have fluid collections on the surface of the brain called chronic subdural hematomas, those are blood clots that liquefy and can cause problems with memory, problems with confusion. Occasionally, it's helpful to inject particles into the middle meningeal artery, an artery that covers the covering, or that supplies blood to the covering of the surface of the brain. It's been found that injecting small plastic beads into that artery to block it will decrease the blood supply to the membrane and then decrease the amount of fluid collection. And gradually, the fluid collection on the surface of the brain often goes away after that procedure, which is quite miraculous.
Now, you're pretty famous for being very available for stroke management and stroke consultations at Community Memorial Health System. And I'm impressed with your passion for being so available. You're pretty much always available. Isn't there a difficulty in being so available for you?
Well, I am usually on call. I occasionally have a day off, but I'm trying to obtain coverage, and we do have some coverage for when I have days off. But yes, I have been on call most of the days, most of the hours in each year that I've been here. But Ventura is a wonderful place to be on call, and I really love it.
Thank you. Well, where is your practice located? I know that you are in the hospital a great deal, but I understand you have a clinic in which you will see stroke patients or post-hospitalization patients.
Yes, the clinic is in the Mountain Tower, what some patients know as the old hospital, and it's on the ground floor where the pain clinic is and where the prostate center used to be.
Thank you.
But most of the patients that I'm seeing now are in the hospital, in the ICU, or in the emergency room, but anyone can call for an appointment in the clinic.
Do you still see patients at Ashwood occasionally?
No, currently I'm not seeing patients at Ashwood.
So it's mainly in the Mountain Tower. Excellent, thank you. Do you have, and you've already alluded to some of that, interests outside of your rather dramatic dedication to medicine, outside of medicine, hobbies? I think you mentioned a few things in the past. Are you still involved in surfing and such?
Yes, I love surfing. I've been surfing since I was about 14 or 13 years old. I started in Boston. I was riding my bicycle near the beach, and I saw some black dots in the water, which I thought were seals. And then I saw one of them stand up on a wave, and I was completely blown away. I couldn't believe it was a surfer. So I waited on the beach until this guy came in, and he was a construction worker from my area, and we eventually became friends, and he started driving me around New England before I had a driver's license. And from then on, surfing was an addiction.
That's pretty cold water, isn't it?
Yes, it's about 35 degrees in the winter. There are stories about surfers diving under waves and running into blocks of ice. That hasn't happened to me, but when I was a kid, the bays that were not moving, not open ocean, would actually freeze over. I also play soccer and play every week here in Ventura. And I do some salsa dancing, and I love to cook French-style food and other types of food. I lived in France for a year during my training and learned to cook some dishes in France that I still enjoy cooking. And I also play music and guitar and ukulele.
Well, I've learned about all kinds of things today I knew nothing about, and I've known you pretty well. Well, we're going to lighten this up even more so. And I'm going to ask you a few questions. This is a stream of consciousness answers. No life or death dependence on this, like some of the things that you do. So we start at the top. Laundry or dirty dishes?
I think I would rather do dirty dishes.
Good. Skydiving or bungee cord?
Oh, that's a tough one. Maybe skydiving. I have a funny story about that, but I'll tell you another time.
Phone calls or text messages?
I much prefer talking to people on the phone than texting.
Nice. Early bird or night owl?
Well, I am both, but if I had a choice, I would be a night owl.
Very good. This was one we were really curious about. Batman or Superman?
I don't follow the Marvel comic book heroes too much, but as a child, I loved Superman.
Super. Time machine or magic wand?
Oh, a time machine, definitely.
Would you go in the future or in the past?
I would go in the past and I would gamble.
Podcast or reading books?
I read books.
Nice. Passenger or driver?
A driver. I'm too much of a backseat driver.
And finally, be invisible or read minds?
Both would be dangerous. I think I'd rather read minds.
Oh, wow. I like that. Thank you for tuning in to learn more about Dr. Nick Tarlov. For more information on all the services and specialties offered at Community Memorial Health System, visit cmhshealth.org and be sure to like and subscribe for more from your community health system. Thank you very much, Dr. Tarlov.
This is your first one.